Good evening and welcome to the Atlanta Autism Consortium's free educational outreach program, Navigating Conflicting Information and Misinformation on Today's Digital Landscape. My name is Michael Morrier and I'm the Program Committee Chair for the Atlanta Autism Consortium Board of Directors. The AAC is a nonprofit organization dedicated to creating collaboration and conversations throughout the Metro Atlanta autism community and beyond. Throughout the year, we host free educational programs just like this on a wide variety of topics, and the entire AAC Board of Directors are so glad that you've all decided to join us tonight. Before we get started, just a few brief housekeeping notes. Please know that as an attendee, your microphone and camera will remain muted, but you can ask any questions you have throughout the program in the chat box at the bottom of your screen. We'll be saving all the questions for a Q&A portion of our presentation in order for the presenter to provide you with all the material prepared. Additionally, this session is being recorded and will be posted on the AAC's YouTube channel in a few weeks. We will email out notification when it's available, as well as any materials and contact information from our speaker. This information will be sent to the email address you used when registering for tonight's program. Tonight, we are honored to have our presentation being provided by Dr. Giacomo Vivanti. He is an associate professor at the A.J. Drexel Autism Institute at Drexel University, where he leads the Early Detection and Intervention program. His research focuses on understanding and enhancing diagnostic and intervention services for children on the autism spectrum, with particular attention to the neurodevelopmental and service implementation processes that shape outcomes. His commitment to this work is deeply personal, shaped by growing up with two brothers with autism who have high support needs. He's authored over 100 peer-reviewed publications and numerous book chapters, and is presented at more than 200 conferences and community events across over 20 countries. He's also a co-author on two papers published in 2025 and 2026 regarding the accuracy of autism information on TikTok, which I believe he'll touch on tonight as well. His research has been supported by a diverse portfolio of federal, foundation, and industry grants, including from the U.S. National Institutes of Health, the U.S. Health Resources and Service Administration, and the Australian Department of Social Services. Dr. Vivanti serves as an associate editor for the Journal of Autism and Developmental Disorders. He's a standing member of the NIH Child Psychopathology and Developmental Disability Study Section, a fellow of the International Society for Autism Research, a member of the Profound Autism Alliance Medical and Scientific Advisory Board, and a co-director of the Early Start Denver Model Training Program. We are honored to have Dr. Vivanti with us today and tonight, and now I will pass it over to him for his informative presentation.
Thank you so much. I am absolutely privileged to be here and to have the opportunity to share a little bit of the work that I did in this area with the Atlanta Autism Consortium. I'm going to share my slides soon, but just as a background, this is not going to be so much a lecture, but an opportunity to reflect together on how do we ensure that we are making decisions that are based on accurate facts, on data, and how do we navigate a landscape in the digital world that is not only increasingly complex, but is also increasingly hostile. When you navigate information about autism on the internet, you're exposed to a lot of adversarial and antagonistic language and climate. And this is making conversations very difficult between families and professionals, between professionals and the autism community. And we with all the stakeholders in the autism space who are ultimately sharing the same desire to improve the life, the quality of life of children and families. So it's a situation that we should change, and we don't know exactly how. And we're going to talk about what we have learned so far about the navigating misinformation, information, and misinformation. So I'm going to share my slides. Okay. So first of all, adults use social media a lot, over 2 hours per day. Younger adults and teenagers from 3 to 5 hours per day, daily. And a lot of what they're exposed to is information about health and mental health and conditions, uh, including conditions like autism and ADHD. When I started being involved in the world of autism, when my two brothers were diagnosed in the 1990s, autism was a technical technical word that only existed in the vocabulary of professional clinicians and psychiatrists. It was not part of any societal conversation. That was not a good thing. So I will tell people my brothers are autistic. Most people wouldn't know what, would have heard that word for the first time. So there was just not knowledge other than for those who were professionally involved in diagnosing those conditions. And those were very few professionals who actually had expertise. That was the early 90s. Things have changed a lot. There is, if you spend 3 to 5 hours per day on social media, which is the average for teenagers, then you will come across the word autism sooner or later, uh, together with other mental health topics that are highly prevalent in the social media space. So most or many younger adults rely on social media in ways that go beyond casual information seeking. And that means that they make decisions, including decisions on self-diagnosis based on content that they are exposed to on social media. This, for example, is a recent study um, that shows that 50% of this large sample of younger adults, Gen X, these are that refers to the generation of those who were born between 1997 and 2012. So digital natives. 50% of this sample identified having self-diagnosed a mental health issue based on what they read or saw online. 50%. And you can see the change, the trend over time. You see that the younger people are, the more likely they will use social media as a way to learn and to inform their actions, including in relation to mental health conditions. Now, generally speaking, this could be a neutral sort of fact. The younger you are, the more likely you choose to learn things from social media instead of other outlets, and that's okay in itself. But mostly this trend is perceived as being alarming, and these are just some of the headlines that you see in newspapers. What is problematic? What's the problem here? Are we saying that people should automatically discard or ignore social media content as it relates to mental health diagnosis or any kind of health information? So generally speaking, this is one of the points that I want to make that will help us navigating these conversations within the autism community. I don't consider to be problematic or pathological the fact that one is trying to find information about some content that is important to them. Maybe they notice something about their children or about themselves that will take only 1 second to learn more about on social media. So the desire to find more information, to learn more about these topics is not in itself the problem. It's actually an asset within the goal of promoting healthy and nuanced conversations on using social media in the autism space. If there is something problematic about it, it has to do with the lack of peer review for content creators. So the content that ends up in social media is, first of all, unfiltered. And that means, obviously, that you're more exposed to the emotional valence of the arguments rather than the process of accurate fact-checking that is necessary for health information to inform action in a way that is beneficial to the end user. It's not only the lack of peer review, it's the lack of nuance and oversimplification that seems to be inherent to the format of social media. I'm going to go back to this topic today. It's not just about the content, it's a lot about the format, the way information is provided. And what we see is a lot of unnuanced and oversimplified portrayal of complex conditions and complex experiences, especially in the brief video format. Within that context, self-diagnosis is particularly problematic because different constellations of different symptoms can result in different diagnoses. Now, in the case of autism, for example, there is not a single behavior that can confirm that someone is autistic or can disconfirm that someone is autistic. It's a constellation of different symptoms, of different behaviors, and it's this complexity that makes it very unlikely that the information that we find on social media is going to be as helpful as information that we can find from expert providers. Also, what goes on social media is not just not peer-reviewed, unfiltered, and lacking nuance. It's also biased. It's biased in a way that you're more likely to be exposed to content that confirms something that you are already into. Basically, this is true, by the way, also for ChatGPT. It works in the same way. The algorithms are designed to confirm the biases that you already have. The more you engage with certain content, the more likely you will encounter similar content that reiterates the same sort of beliefs. So before we talk about how this is relevant to autism and understanding autism, whether you are a person who wants to learn more about whether you yourself are autistic, or whether you are a parent or a family member who wants to learn information because you believe that your children might be autistic, or whether it's someone who is already diagnosed and you're looking for information on interventions and services and supports, it is important to, first of all, understanding the sort of intent of those who create content about autism and other conditions on the internet. So, generally speaking, what are the incentives to create content for social media? Creators seek and experience social attention by sharing information that will impress the online community, not that will inform the online community, that will impress. They're not trying to inform you, they're trying to impress you. This is important because to impress someone, you don't need to be accurate. So this impressing the viewers has little relevance to the accuracy of the information, because accuracy is not reinforced. It's not necessarily punished. You can put an accurate statement and you can make it very impressive too, and that's okay. But what is rewarded is the sensationalism. So a lot of accurate information might be more boring than inaccurate information because it's less sensationalist. And so the incentive is to sensationalize. That's not the only intent of content creator. Creators create content because of affiliative motives. They want to signal affiliations with a specific community through specific content. For example, because of my research, I see a lot of social media content, and a lot of the content, including from in the autism space, is about distrust towards the establishment. Don't trust your doctor. So you don't trust who tells you that you should do this and that, and so on. So that content helps you, the creator, feeling connected with other people who then will engage with your content because they have similar sentiments about that. So you create content and you get not only attention, but also community affiliation. Another important component is that the format of social media is conducive to a nuanced statement regardless of intent. So I'm writing this because there are content creators with good intentions. They do want to write the right thing that is going to be helpful for people. The problem is that the format in itself, the space that you have to communicate the content that you have, and the sort of competing for attention among other content will be conducive to a nuanced statement, even if your intention is to inform with accurate information. Also, content on social media is shaped, right, by the ongoing sort of style that is expected to be and that is rewarded. So a polarizing style is expected and rewarded. So if you are a digital native and you are creating content, you've been exposed to content that is polarizing, that is antagonistic, so you're more likely to use that same sort of style. And then there is the context specific to the autism field. And that is very important to acknowledge. The context of autism is a context of gaps in scientific evidence, underrepresentation of certain groups, animosity, historical animosity, including among scholars, and mistakes from the scientific community, and also very slow progress. So this context is very important as we're thinking about how do we handle the competing sources of information that end users, families, and individuals on the autism spectrum and so on, and anybody engaged with autism needs to navigate. I can't just tell people social media is trash, academia is perfect. It's more complex than that. So there's another twist to this whole conversation. So early on, when most of the autism debate started to be on the internet, people used to be dismissive and say, don't trust these unofficial sources. You need to trust the official sources, the National Institute of Health, the CDC, and all of that. So this is now more complex because social media influencers are traditionally anti-establishment. They tell you, don't trust the establishment. I'm going to tell you how you can diagnose your child. I'm going to tell you the real things that help children. And now the establishment, which is the authorities providing guidelines and regulations, also produce anti-establishment media content. So what I'm saying is that, and I'll go back to it, is that you might hear anti-establishment content that come from directors of those same agencies, like the National Institute of Health, or especially the US Department of Health and Human Services, which is the organization that presides over the National Institute of Health, who are themselves sort of anti-establishment influencers or act as if they were. So it is important to acknowledge that both the format and the content of social media information about autism and other conditions is adopted in political communication, and it's increasingly encouraged in scientific communication too. So again, we cannot dismiss this entire business through a simple, don't trust the internet, trust, someone with an official title, with an official channel, and with a lot of titles. It's more complex than that. So now, to make sure there is a backlash in the world of research against this sort of production or use of anti-establishment content by official channels. So I'm talking about political authorities or regulators who use the same sort of arguments that you find on online forum to produce social media content that is arguably inaccurate and misleading and dangerous. So here I'm going to mention two examples of such content. The first one is the content that links vaccines to autism. And the second one is the notion that there is an autism epidemic. So what I put in the slide are two recent editorial, one by Shefali Gulati and colleagues, the other one by Eric von Bonn, that address this new surge of sort of mixed messages, let's call them mixed messages, or messages from, including from authorities presiding health production and, well, health research, basically spreading misinformation. This is one example from the Eric von Bonn editorial. Recently, he wrote about the Secretary of US Department of Health and Human Services, claiming that the US estimates of the prevalence of autism confirm the existence of an autism epidemic, and that the autism epidemic is driven by an environmental toxins, which will be found. These claims are contradicted by studies showing that progress in the understanding, detection, diagnosis, and management of autism have fueled the increasing prevalence. So I am not stating here that once you write an editorial where you single out a specific claim and you show the data that support their inaccuracy, that will solve the problem. But this is something that we can and we should continue to do within the autism scientific community. But let's be specific about the way in which the information about autism can be biased, and can bias the view of autism in a way that change how people even interpret such word. So 3 years ago now, together with my students, Diego Aragon Guevara and Grace Castle and my colleague Elizabeth Sheridan, who were here in the same AAC forum 3 years ago, we presented what at the time was the first study looking at the reach and accuracy of information on autism on TikTok, which by then was at the peak of its sort of popularity as a social media forum. I'm hearing that it is not anymore at the same level as when it was in 2023. But basically, back then, that was new, and then it's been replicated a few times. I will talk about it. But we basically were concerned about two potential ways in which social media could bias the views of autism. One was through inaccurate information. For example, people being exposed to videos claiming that a certain product will cure autism, and that inaccurate information will create different baselines of facts, having different communities or different stakeholders having a different idea of what constitutes a fact, an autism fact. And the other concern that we have was overgeneralization. And that means that individual experiences was overgeneralized to the entire autism spectrum and not representing the entire spectrum of manifestations within the autistic population. For example, the idea that the experience of an autistic person who is male and white and low support needs will be relevant to someone who is not identifying as a male and not white and maybe with higher support needs and so on. The idea that one experience can be relevant to everybody's experience. So we basically what we found in that sort of examination of the top 100 most liked and the first ones to appear on a new TikTok account that had the hashtag autism was that most of the content, 73%, was either inaccurate or overgeneralized. We also found that this information was reaching a million people, although you cannot distinguish the number of views from the number of people viewing, but certainly a lot of people was exposed to that. And we found that inaccurate or overgeneralized information was liked and viewed as frequently as accurate information. Again, what we did here was fact-checking using two independent coders that will examine statements within the videos to identify whether they were supported by the data or not. So one example, I had it here. An example of an accurate statement will be, many autistic children can benefit from using alternative and augmentative communication. This is true. An example of inaccurate statement will be, you can determine if you are autistic using this simple 3-question test that I'm going to sell you through this link. And one example of overgeneralization was autistic children hate to play with sand, for example. Now, what's important here is that if we had videos of people just posting about a personal experience, such as, I went to this new autism-friendly show and I found it great, we will not consider that video relevant to this study. We're not trying to decide whether personal experience is true or false, but videos that have the intention to educate about autism. Now, since then, this has been replicated a few times, and I'm showing two of the replications of the study that have more discrepant results, in a sense, between them. So they're both very recent. The first one by Brown and colleague found that only 24% of videos, according to their way to classify content on TikTok, was considered to be useful. So almost 80% being misleading or overgeneralized. And this is the most recent by our colleagues at Rutgers. Vanessa Ball and colleagues found that only 6% of videos, again, using the top most views, most liked videos, will be characterized as clinically accurate. So more than 90% not being accurate. Brennan and colleagues also talk about this issue of personal experience video, people posting about personal experience without the intent of educating people about autism, but just sharing something about themselves. So they wrote, many popular videos are intended to share experience rather than provide education. But the intent may not be clear, which may leave consumers vulnerable to misinterpreting the information. This creates a tension between the freedom of individuals to share lived experiences that resonate with large audiences and the need to prevent the spread of misleading or overgeneralized information, which may influence self-diagnosis, over-pathologizing of behaviors, or discord within the community. So there is a tension here. It's not a simple, again, everything on TikTok is wrong and terrible. And someone who's posting something has the intention to deceive you. It is not like that. And I particularly appreciate the point of the freedom of individuals to share lived experiences that resonate with large audiences, that finding a connection with a community of people for whom that experience resonates, it's not the issue there. It's, again, it's the format and how you navigate that information. Now, our colleagues at Boston Children's Hospitals recently published this paper, which takes this kind of studies one step forward. So here, they looked in a much more analytic way about what is this misleading information? What is the different types of misleading information? Then they classified according to four different categories. The first one is claims about causes of autism that are scientifically unsubstantiated. For example, a video saying ASD is caused by poor parenting or vaccines. Another category that they identified is false cures or treatments, and that is about promoting unproven or harmful treatments. For example, this herbal remedy can cure autism. Another category is misleading statistics, use of incorrect or manipulated statistics related to ASD. For example, 90% of people on the autism spectrum are unable to work. And then conspiracy theories statements. Those are claims that autism is the result of a conspiracy, such as government plots or vaccine misinformation. One example being vaccine caused autism, and this is covered up by the government. So they looked at the frequency in percentage of these different types of misinformation. And you can see that they found 47% of the videos that they analyzed, they were promoting misinformation related to the causes of autism, such as autism is caused by poor parenting or vaccines. 30% was about unproven or harmful treatments of autism, and most of the misinformation was about manipulated or incorrect statistics. 90% of individuals on the autism spectrum do this or that. And then a very high number of videos, 42%, that had explicit conspiracy theories. Okay, now that I talked about all of these negative things, I really want to talk about the potential benefits related to social media in relation to autism, and then we're going to talk about how to navigate this complex landscape. So, first of all, videos that anecdotally document the lives of autistic people and their families. They are anecdotal, meaning it's not the same as a research study, but they're not meant to be. If they do not claim to disseminate knowledge on autism, those really are important because they have the potential to reduce stigma and information and provide information about lived experiences. I really enjoyed recently seeing a video of a parent of a young adult with high support needs. They went to Disneyland and they were talking about how this specific experience was positive because of the way the staff was acting and all of that. That is not trying to educate you about autism. It's just personal experience, and it's positive. As I said, when I started, I'm trying to learn about autism in the 1990s, I had little access to any educational source or information. So again, positive information, accurate information is there, is on the internet. The problem is that it coexists with inaccurate information, and they are perceived with the same level of authority. But it's there, and it's more accessible than anything that academics create. It does promote a sense of community and shared identity. I grew up as a brother of autistic brothers who autistic siblings who I didn't know anybody else who was in my same condition before the internet, because I thought that it was a very rare situation, and it was, I guess, because of how infrequent that diagnosis was at the time. So now if you've been diagnosed with autism, or if you have someone who is a family member diagnosed with autism, it wouldn't take long to find other people who have a similar experience. So this is good. Increased awareness of disability, autism being part of a larger societal conversation that goes beyond the academic literature. This is good. Decreased stigma, most likely. Social media discourse has contributed to decreasing stigma and prompting self-discovery and reflections. These are all positive sides. It's not, again, I'm not dismissing the value that social media content can have in relation to autism. And this is a nice study by our colleagues in Norway. They did a focus groups with young autistic adults who are social media users to understand their experience interfacing with social media. And what they reported was that they were looking for information on autism on official health pages, but they couldn't find information that answered their questions about themselves or resonated with their experience. And so they did move to find that information on social media platform, despite the fact that they perceive social media as an unreliable source. Now, by the way, this is true also for neurotypical individuals, and this is part of the research that I talked about earlier, about people, up to 50% of people in certain age ranges searching for and making decisions based on social media content. Many of those people report that social media content is not to be trusted. So people use social media while also not explicitly stating that they trust what they read. It's more about the perception that you have to be able to disentangle information that can be trusted and information that cannot be trusted. So it's very complex. But in this study, the participants who were young autistic adults, they found content on social media that was positive in relation to their autistic identities. But they also reported feeling alienated by the aggressive tone, which did not provide a sense of community online. For example, mentioning that this, I don't know, receiving, for example, a diagnosis based on the DSM-5 was a positive experience, or receiving specific interventions or services that could trigger a strong reaction. So interestingly, this is a paper that I published recently where I make the case that this is happening more and more outside of the social media domain, and also in the general way in which scholars and people in academia and policymakers operate. And part of which and what I'm talking about is a climate of very heightened sensitivities, and talking about something or touching on certain arguments, creating a lot of animosity. And so part of this is not the fault of social media. Part of it is because when we are talking about autism, we are engaging with constructs or concepts or ideas that are both emotionally charged but conceptually fuzzy, which means words that mean different things to different people but cause a lot of emotions. For example, neurodiversity affirming practices. This is a concept that refers to using intervention practices that are respectful to the identities of those on the autism spectrum. But if you ask 10 different people to operationalize, to clearly define what a neurodiversity affirming practice is, they're going to give you 10 different answers. There's not a clear definition for that. And so when there are not clear definitions for things, but different people, but words assume different meaning for different people, then you have these situations where me using a word in one context is causing a lot of emotions for someone who's thinking about that same word, but in a different context with a different meaning. So this antagonistic atmosphere that is permeating scholarship on these topics influences and is influenced by the tone of social media discussions, where again, combative statements that foster us versus them narratives are rewarded over critical reflections that acknowledge complexity. What we need is to embrace nuance and complexity. That's why I'm trying my best not to come across as the academic who tells you that everything is wrong about social media. So where do we go from here? So first of all, as a researcher, I feel like my responsibility is to create better science to fill the gaps and address those needs that lead to use social media for answers. Users are going to use social media to find answers if we do not provide answers in services, supports, and clear communication of scientific knowledge that addresses the needs of individuals. We need to help the individuals and families navigating sources of information through what I call here patient-centered strategies, which means I don't go to people saying autism is this. I go to people who are coming to me for my expertise, asking them, what are your needs? What is your experience? And based on your specific needs and experience, we can think about what is it that exists on social media that will be relevant to your situation. We also need to navigate conversation that helps people understanding the implications of different kinds of knowledge. Personal experience is different from population data. Anecdotal experiences doesn't mean wrong. I don't care about it. It's important to learn about people's experiences, but it's not the same of population data. Acknowledging context, including validating concerns, but highlighting content-specific issues. If someone tells me, I learned on social media that the way autistic children learn things is X, Y, and Z, before I say, whatever was on social media is likely wrong, I should ask the question, why were you looking for that information? Most likely you noticed something, and whatever you noticed, that's my starting point. Validate the observations that then led you to find answers to the questions that you had. It's very important to acknowledge the different populations and stakeholders in the autism community, to avoid reinforcing and perpetuating overgeneralization. What you have learned about this person might be true, but it might not be relevant to your specific context. And also for those who are engaged in research and clinical and educational work, and public health work on autism, it's important to be aware of the trending content that might pose barriers to trust, communication, and shared decision-making. For example, if there is a lot of content that I'm not aware of about a specific, intervention, or about a specific word that I'm using, and I'm using that word, that will trigger potentially emotions that might lead to mistrust. And again, I can do a better job using words that do not antagonize the families and individuals I'm talking with if I'm aware of the conversations that are happening on social media. At this point, I talked a lot, and I would like to stop here to see if there are questions or comments from you. So I'm gonna stop sharing.
And if anyone wants to verbally make a comment, just raise your hand and we can unmute you, or you can type it in the chat as we're going on. I mean, I think this has been some great information going that you've provided, and I especially like that you've done the positive side of social media too, because I think we all concentrate on the negative side of it, and there is some positives that can be out there.
I should also mention, I am not a TikTok user, and I am not a Instagram user, and so that's why I do these studies with my students, and so I am biased in a way where I am very unlikely to fully grasp the benefits of the content that is in this research.
Someone is saying families of individuals with profound autism are often underrepresented in research, but overrepresented in crisis. How can we help those families discern information when the evidence base doesn't always clearly reflect their child?
Yeah, I think about that a lot. So first of all, profound autism is one of those words or phrases that create a lot of emotions on social media. I got a lot of negative social media attention, including from my own colleagues who posted on X that I was an illegitimate researcher for just engaging with the words profound autism. So it's really, you're always walking on eggshells nowadays, and this is one of those topics that causes that. Now, the more needs or the more for those who have more intense or more intensive needs for services and supports, equally there should be more access to accurate information, unbiased information, and information that doesn't, or content that doesn't blame those who are using those words for trying to understand what to do. In terms of producing research that helps families and individuals with profound autism, we just need to basically have more legitimacy for that concept because it's still controversial, and so it can be more difficult to fund your research projects for that particular population. But also just thinking about when I have a population that is underrepresented, I just need to think about how do I do things like oversampling for that population when I recruit participants, and how do I make sure that everything that I'm doing is that I consulted with those who are personally affected by that condition, by how I make sure that I engage with the experiences of people in that in that group before I create or produce any content.
Okay. And someone else wants to know if you find trends in social media regionally in the United States and internationally, specifically as it relates to the availability of services.
Yeah. So there are two studies. One study on social media content in France that is coming out soon, and one in Italy. There seems to be less misinformation in not in general, but it is produced on social media platform, by the way. So I'm not assuming that everything that we're learning about TikTok in English speaking sort of content is going to be the same internationally. But generally speaking, that information is the most difficult to find. Services and supports. What do I do? Who do I call when I need someone who helps with, I don't know, my child or young adult going to the swimming pool, or autism friendly anything, or ABA services or other types of intervention services. Finding that information, it's difficult because first of all, it's very local, it's very contextual, and again, you end up in a rabbit hole of people who are trying to sell you things the moment they understand you that you're looking for help.
And then Dr. Saulnier commented about when she didn't diagnose a young woman with autism who was convinced she had autism because of social media. She asked why everyone doesn't have access to the accurate information. So she gave her your article and told her to share it.
Yeah, this is the difficult. I mean, there's a concept here that is complicated, and it's the concept of validation. So someone comes to me and they have sort of identified that they feel different from other people, and they feel different because the way they socialize is different. So you are in a difficult position where you want to validate those feelings. If you feel that you are different, those feelings are real. Okay. That is different from meeting criteria for autism, which is about behaviors and very specific behaviors that meet certain criteria. Now, you can also say it's okay. You can challenge those criteria as well. You can say this is arbitrary. Yes, it is. It's a consensus sort of statement. Is it going to be the same 20 years from now? No, they're going to change them for sure. But currently, we do need to have a reference point, and this is the reference point. That doesn't mean that the way you feel should be invalidated. These are difficult conversations, because what we come across when we don't give the diagnosis that people want to have is that we're not taking them seriously, when in fact it will be the opposite. To give someone the diagnosis that they want, it means that you're not taking that person seriously. It's the easy thing to do, but it's not the right thing to do for that person. It's not beneficial for you to receive a diagnosis that is not reflecting of your current behavior.
And then someone else wants to know, is there any value or impact in commenting or calling out the misinformation that influencers are posting? Like, for example, a counselor or a doctor posting, if you say yes to these 3 questions, you might have autism, or that people would list the symptoms that are not in line with the diagnostic criteria. This person doesn't engage, but finds some of the videos and posts so inaccurate and confusing for parents. Do kind of commenting on them or calling them out increase the traffic or the attention to those posts?
That's a very good question. It can definitely backfire. You can be basically engaging in that behavior that the content creator wants to, which is attention, traffic, and negative attention is expected. When you create content, most of the time that content is expected to create negative attention. So your negative attention is part of the game. It's not the, haha, I'm a doctor and I discovered, I'm now letting the world know that you are wrong. It's expected. It's part of the narrative that there will be. The establishment is going to tell us that I'm wrong and they're right, but we don't trust the establishment. And I don't know, maybe ignoring is the best option, but then you need to be aware of that content when you have the conversation with the families who've been exposed to it.
I mean, this has been an amazing presentation and great information.
Thank you. Thank you also for the great question. Again, I have a lot of questions and few answers, but it's important to reflect together on these topics.
Yeah. And I'm glad you spearheaded the research on this because I think people really weren't. They were talking about it, but no one was really, really looking at what is out there. And I think your paper and your students' paper really kind of led people to let's start looking at this.
Thank you. I appreciate it. Thank you so much for having me.
Yes, thank you very much. And thank
Okay.
everyone for attending.